Here we are at Sveti. Today we're going to pay some attention to the youngest population, in fact the children, and to the need for early detection of changes in the eye at the youngest age. What's the most important is early screening, which means that the child has to undergo an ophthalmologic examination immediately after birth. Why? Because the normal development of visual function requires that all the structures are preserved. This comprises the transparent cornea, anterior chamber, transparent lens, vitreous body, and preserved structure of the posterior segment. Nevertheless, the development of visual function in children is intensive since birth until the age of 2 or 3, when, at the age of 3 or 4, the development of the so-called binocular vision is finished and the child acquires stereo vision. If there is any organic change, anatomical disturbance in the eye, the development of vision in that eye won't be adequate. In the same way, it's also possible that the anatomical structure is preserved, but the visual function isn't preserved, which is usually caused by a refractive anomaly in the eye, a diopter problem that, of course, should be noticed and detected early. If any organic change in the eye is noticed early, which could be blurring in the cornea or cataract, such an anatomic change should be removed as soon as possible, because in that way we'll give a chance to the child to force and develop visual function in that eye. Cataract surgery in children is performed very early, at the youngest age of 2 months perhaps, if such cataract is considered significant, if such blur is central so that it disturbs the central visual axis and doesn't give any chance to the child to form a picture. If cataract is minimal, if blurring is peripheral, and if the central axis is preserved, such cataract should be monitored, of course, in order to preserve the accommodative function of the lens. The role of the lens isn't only to let light in, but also to refract the light, which means that it changes this feature, its refracting function, through reinforcement and reduction, which we call accommodation, and which means the ability of the eye to see both near and far objects sharply. So cataract surgery is performed at the moment we consider it significant, because we tend to preserve the accommodation of the eye. And if there's no sharp picture, then anyway we have to replace such a lens with an adequate one. For the development of visual function, it isn't only important to remove the existing blurred lens, cataract, but we also have to incorporate an appropriate implant, because it's the only way to give the eye a possibility to see properly. Therefore, we have to correct such a refractive error at the mere beginning. This should be solved exactly at this moment, important for the development of visual function. If it remains uncorrected at the age of 8, when the development of visual function is finished, we'll have an amblyopic eye. After that, surgery won't be as useful as it would have been if it had been performed at the time until the age of 4. The same could be applied and understood as a diopter problem in children. Here, it's not about an anatomical defect, but a functional defect, an impossibility of adequate correction, especially in situations where there is a large difference in diopter in both eyes, which can't be corrected with glasses, because for glasses it's important to have a balance. So the eye with a higher diopter value most often remains undercorrected. The brain receives different images from both eyes. These images have different sizes, and we call this anisoconia. And this is a confusing situation for the brain, which excludes the weaker image and forces the better eye, so the eye with a higher diopter value remains amblyopic.